to be as I guess as inclusive as possible. We were really mindful of the LGBTQ plus community and also those with neurodivergence, because again, given that the resources at the moment are essentially printed leaflets, we just wanted our resource to kind of meet the needs of as many young people as possible. So this is what we did. We essentially kind of developed characters. So this is Frankie. Frankie is taking fluoxetine. We used Bitmojis from Snapchat. The names that we chose are gender neutral names. We don't use pronouns in any of the videos. We chose a sans serif font, and the font size is kind of greater than 30, so it's large enough. The videos are about 2 to 4 minutes long. Although I just made one on clozapine and it's over 4 minutes, but I think that's justifiable. At the end of the video, there is an option to screenshot a summary of the information. This was feedback actually from the Joseph from Spun8, because like that, most people are going to be watching this information on their phones, and it's handy to do a screenshot, and then you can kind of save the information then to refer back to it. We had also originally made the videos in landscape orientation, but the feedback again from Joseph was to change it to portrait, because obviously people, when they're watching their phones, they have it in portrait orientation. The language and imagery. So I always laugh at this image of the vomiting Frankie, because we had included this in the first round, and it was kind of a resounding no way from the consultants, because like that, if you're offering a young person a medicine and they can see that they might be spewing green vomit, they're really less likely to take it. So we removed that image. But it was really interesting, I thought, to see that, the feedback. There was another image where we had a young person lying on a couch, and it was kind of like there was no, I guess I didn't even think about it. It was at the end of the videos where we ask, or we advise, if you need more information, you can talk to your doctor or pharmacist. And the particular image, it was a young person lying on a couch saying, "Let's talk." But the feedback from one of the consultants was that is just playing into this stereotype of when a young person is in a mental health service, that they just lie on a couch and talk about their problems. So I thought that was really interesting. So we obviously removed that. We used very clear and simple language. There's kind of less than 20 words per sentence. We avoided jargon as much as possible. So, it's we didn't want to use the kind of technical terms. So we said brain cell instead of nerve cell. And I think that was one of the examples. And then obviously we avoided the vivid imagery, so we removed that. Actually, one of the other images we had was for headache. We had someone with an anvil on their head. But again, it was kind of considered that's a bit much. We don't want people to think that the headache they'll get taking a medicine is as sore as an anvil being dropped on your head. So the clinical content then, as I said, like we based it on the patient information leaflet. We looked at on our own clinical experience, the clinical experience of all the collaborators. And we essentially go through what the medicines do, what they help with, how long they take to work, the most common side effects, how to stop taking them when they're no longer needed, when to take them, and then some other information. So what we have so far, so we started, I think I first made the video in April 2023. And then, it was kind of a process. We were kind of back and forth. Obviously, then we had the summer in the middle, which slowed things down. But we had our final eight videos, and we kind of launched the website in early October. So we have 8 videos live. We have you'll see them now, I think. Oh, that's the video, or the trailer. Sorry, we've 8 videos live. You'll see them now on the website. We have the website, and then another bit of feedback that we got from the young people was that they wanted to know, what was in the videos, because when you look at TikToks, they're usually much shorter, 30 seconds or less, some of the videos. So the young people wanted, a short, succinct summary of what the videos were about, and that they were kind of from a reliable resource. So we decided to make a trailer essentially on it. So I'm going to just show you the trailer. Now it's just going to play in the next slide. Are you a young person looking for accessible information on mental health medicines? Listen to Frankie, Ollie, Max, and friends talk about a range of medicines and give information on what they do, what they help with, how long they take to work, the most common side effects, and some other important information. These short videos were co-produced by a group of pharmacists, doctors, nurses, and young people, and are available at Med.Info. So this is the website. So these are the videos we have. So we had methylphenidate, fluoxetine, and olanzapine, and because we had, I guess, an antidepressant, an antipsychotic, and a stimulant, we were able to kind of replicate those kind of frames into similar medicines. So we did another 2 antidepressants. We did sertraline and venlafaxine. We did aripiprazole and risperidone, and then we did lisdexamfetamine. So this is what the website looks like. It's basically youthmed.info, so www.youthmed.info. And then we have on the side some of the tabs here, which I'll show you. So as well as obviously giving their 3-minute video, we wanted to be able to signpost young people to where they could get more information. So we have on the website, there's an option, you can see there the more info section, the yellow box, and that brings you here. So it's basically this. So we refer people to the manufacturer's patient information leaflet. That's where they get their lovely 11-page thesis on the medicine. Also then the choice of medication website, which is brilliant because as well as obviously the PDFs and the printable leaflets, there's lots of frequently asked questions on the choice of medication website, which are really good and a really great resource. And we also then refer to the NHS UK website. So there's, again, you want to be able to say to young people, if you need more information, here's where you will get reliable information. As opposed to them looking it up in a social media platform and kind of getting questionable results. Then these are our 14 collaborators. So as I said, the 2 specialist mental health pharmacists, 2 academic pharmacists. We had the 4 people from Sunlight and the 5 psychiatrists, and then the director of nursing. And this, I guess this was kind of well received because and it was fun to do, was to immortalize everybody via Bitmoji. But it was a nice way of we want the young people to know, we wanted there to be transparency, to know that there were actually specialists involved in the development of this resource, so it is reliable. And so it was really important for us to share this information. I'm just going to read this. So Sophie, I'll show you. Sophie's there in the top right. Sophie was one of the action panelists, and she was brilliant. And she actually came to our launch, and there's really nice photos with her. And she has kind of expressed an interest in continuing to being involved in the resource. So we're still in touch with her, which is really nice. But she wrote us a quote, which I thought was really, really valuable, and I'm going to use it a lot. So I just want to read it through for you guys. So, as a contributor to youthmed.info, I'm proud to see this valuable resource launch. It empowers young people navigating mental health treatment with clear and accessible information. These videos provide a safe and empathetic space for us to understand their medicines fully. This collaborative effort will make a genuine positive impact, and I hope we can continue to expand this project. The voice of young people matters most in their own healthcare, and youthmed.info helps them to stay informed and listen to young people each step of the way. I have another quote, and actually I only added this in this week because I shared this with, I'm on a kind of group, an email group with CAMHS pharmacists across the UK. And I had shared the URL and, you know, gave information about the resource when we launched it, so back in October. But maybe last week, one of the pharmacists just got on to say, I remember someone mentioning, you know, they had videos for teens taking mental health medicines. I can't find the email. Would someone share it with me? So I obviously shared the details. But this was the reply then I got from her, which was really nice. What a fantastic tool for engaging a young teen. We watched it and it allowed a conversation afterwards. But yes, it felt so much more relaxing going to see the anxious young person and suggesting we watch a very short YouTube together and then talk about that. So a huge thank you. So this was from a pharmacist who had a young person who was, you know, really, really debilitating anxiety and really wasn't in a position to read an information leaflet, was really also anxious about a medicine, you know, potentially starting a medicine. So this was kind of a nice thing to do, was for the pharmacist to go meet the young person, and actually they watched the video together. And that's actually what I do with the young people in the hospital, is I just go up to the ward with my phone and I just show them the video, and I print off then the summary sheet at the end. So we're on social media now. We obviously have the website, so Med.Info, but we also, the videos are actually hosted on YouTube. So when you click on the website, it redirects you to YouTube. We've also then put them up on TikTok, and they're also on Instagram. So, you know, feel free to follow and subscribe to any of the channels, because I guess this is where we hope to, you know, once we have more information, we'll add it on to this. Now, I guess I need to advise that this isn't a funded resource. We did this ourselves. You know, we weren't funded to do this, and so the platforms are run by me essentially, and so I'm not posting daily stories or anything. I'm literally, it only has the information resources, the videos, and it has the trailer. But like that, as we get more information resources, we'll be able to post them on these platforms as well. So what's next? So we actually have another 8 videos that we're hoping to we're kind of reviewing them at the moment, but we're hoping to get them up soon. So we're looking at videos on more medicines. We also, and this was kind of a tip from, again, Spun8, was they were interested in like FAQs. They said FAQs get a lot of interaction from when they publish them on their platform. So they kind of suggested, you know, if someone has a query about a side effect, would there be a video on it? So we decided to actually, you know, look at specific side effects and develop videos on specific side effects. So we have weight gain, I think actually I have a slide, I'll show you them. And then, sorry, we also wanted to look at videos for targeting younger children, and this was feedback from the community services, where they said obviously they have teenagers, but they also have younger children who are taking medicines for their mental health. So you know, the most popular medicine was methylphenidate, but there are other medicines. So they were really keen to get information videos for kind of a younger population. So yeah, this is kind of what our version 2 of the website will look like. So we're hoping to add clozapine, promethazine, quetiapine, guanfacine, lorazepam, melatonin, atomoxetine, and mirtazapine. So we've another 8 that are kind of in the pipeline, and we'll hopefully get them up soon. So like that, if you are interested in you know, in any updates, you can subscribe to the relevant channels, because once they're live, we'll stick them up there. So these were the kind of 3 pilot side effect videos that we looked at. So weight gain with antipsychotics, nausea and vomiting with SSRIs, and then also increased prolactin with antipsychotics. So we have the weight gain videos kind of ready, you know, it's like that. It's kind of one of those processes where we need to kind of figure out what questions people want to know, and then how do we answer them, and, you know, with the right information. So So there, and then these are the young people, the videos for the younger children. So we've methylphenidate, lisdexamphetamine, and melatonin. So actually, I got my kids to do the voice for these because there's two versions. So there's an adult, like there's a parent version, and then there's the version for the young person, for the child. So I voiced the parent version, and then I got my kids to do the voices for these, which was a very interesting task, trying to get a 7-year-old to say lisdexamphetamine and get a 9-year-old to say methylphenidate without dropping the T at the end. But they were paid in cola mentos, and it went pretty well so far. So these again are in review, and again, it's about finding that kind of happy medium where everyone is, I guess we want everyone to feel that they'll use the videos. If we kind of meet with kind of, I guess, respond to one set of comments and not another's, then maybe only one type of clinician might use them and not another. So it's an interesting process, but that's kind of where we're at the moment. So the younger children is taking a little bit longer than we had anticipated. That's the URL for the website. I don't know why I have that in, because obviously you're on your phones when you're doing this. But it's there. I think you get a copy of the slides, so you can have a look. I'm also sharing a poster that I put together, which actually just has all of the. Where do I have it? Oh, no, I don't. It has all of the.
This is Luca.
Sorry,
Luca is taking lisdexamphetamine, also known as Tyvens, and some other names. Mental health medicines like lisdexamphetamine can help people who find it hard to plan, organize, manage time and impulses, and finish tasks. When this happens most of the time, it can cause problems in everyday life. Lisdexamphetamine is a stimulant that increases the activity of dopamine and noradrenaline in your brain. Dopamine and noradrenaline are naturally occurring chemicals that carry messages between brain cells. They play a role in regulating your attention, behavior, focus, and concentration. Luca is taking lisdexamphetamine to help improve focus, hyperactivity, concentration, and impulsive behavior, which can all be symptoms of ADHD, attention deficit hyperactivity disorder. On starting lisdexamphetamine, Luca felt some effects within an hour, especially around impulsive behavior, but the full effects of the medicine built up over 4 to 6 weeks. During this time, Luca noticed some side effects. Side effects are more common on starting lisdexamphetamine, and many go away as you continue the medicine. Some side effects may not go away, but if you are worried about them, or if you feel that the medicine isn't helping, your doctor can make changes to find the right fit for you. The most common side effects of lisdexamphetamine include headache, trouble sleeping, stomach ache, dizziness, dry mouth, loss of appetite, feeling more anxious, and racing or fluttering heart. There are some physical health tests you will need to have before starting lisdexamphetamine and during your treatment. These tests will check for side effects to make sure any unwanted changes are found and managed early. These include a heart check and weight and height measurements. There are some other things Luca thinks you should know about lisdexamphetamine. Don't stop taking lisdexamphetamine suddenly. Your doctor will be able to advise you on the best way to stop the medicine. It's a good idea to take lisdexamphetamine at the same time each day. Luca takes it in the morning with breakfast. If taken too late in the day, it can affect your sleep. Luca's treatment with lisdexamphetamine is reviewed every 3 to 6 months, and the decision to continue the medicine is discussed. This involves a chat about the benefits and the risks of taking the medicine. Lisdexamphetamine has tighter controls when it comes to supply. It needs to be written on a special prescription, and this must be taken to the pharmacy within 14 days of writing. If you notice that you get much more angry or agitated than usual when taking lisdexamphetamine, or have thoughts of harming yourself, you should speak to your doctor straight away. For more information on lisdexamphetamine, you can speak to your doctor or pharmacist. or read the patient information leaflet. If you want to save the important information from this video, take a screenshot now. This video was co-produced by a group of pharmacists, doctors, nurses and young people for Med.Info.
I hope I'm a little bit scared now to touch the screen, but that was the lisdexamphetamine video, and I have I have two others that I can show you, but I don't know if we have time. If is it better to take questions now? Maybe Ruth, you can guide me on that. It's another. I can show the sertraline video.
If you want, there's no questions in the chat, so I'll invite people to pop some questions into the chat while you're playing the video. It might give people a chance to do that, and then we might come back, the two of us, and have a quick conversation. Yeah,
super. I'll play. I don't know, Ruth, you can choose. Do you want an antidepressant or an antipsychotic?
Oh my God, the joy on Valentine's Day. Psychotic.
Perfect. I think it's aripiprazole, so I'll just play it now. Oh, there. Sorry.
This is Alex. Alex is taking aripiprazole. Sam is taking sertraline, also known.
I think I just need to start again.
This is Alex, also known as Lustral, and some other names. Also, mental health medicines like sertraline.
I'm gonna go back.
This is Alex. Alex is taking aripiprazole, also known as Abilify. Mental health medicines like aripiprazole can help people with a serious mental health difficulty on their recovery journey. A serious mental health difficulty makes it very hard to manage certain feelings, thoughts, or behaviors, and causes problems in everyday life. Aripiprazole lowers the activity of dopamine in your brain. Dopamine is a naturally occurring chemical that carries messages between brain cells. It plays a role in regulating your thoughts, emotions, behavior, and perceptions. Alex is taking aripiprazole to help with feeling agitated, very excited, and elated. But it can also help with strongly believing things you usually don't, hearing or seeing things that aren't there, and having intrusive and distressing thoughts. On starting aripiprazole, it took 1 to 2 weeks for Alex's symptoms to improve. The full effects of the medicine took 4 to 6 weeks. During this time, Alex noticed some side effects. Side effects are more common on starting aripiprazole, and many go away as you continue the medicine. Some side effects may not go away, but if you are worried about them, or if you feel that the medicine isn't helping, your doctor can make changes to find the right fit for you. The most common side effects of aripiprazole include feeling restless, shaky hands, trouble sleeping, headache, constipation, stomachache, and blurred vision. There are some physical health tests you will need to have before starting aripiprazole and during your treatment. These tests will check for side effects to make sure any unwanted changes are found and managed early. They include a heart check, weight and body mass index measurements, and blood tests to check how your body handles sugar and fats. There are some other things Alex thinks you should know about aripiprazole. Don't stop taking aripiprazole suddenly. Your doctor will be able to advise you on the best way to stop the medicine. It's a good idea to take aripiprazole at the same time each day. Alex takes it in the morning with breakfast. To have the best chance of staying well, aripiprazole should be continued for between 6 months and 2 years, depending on the reason why you're taking it. If you notice that you become much more impulsive and start spending more money, eating more, or gambling, you should speak to your doctor straight away. For more information on aripiprazole, you can speak to your doctor or pharmacist, or read the patient information leaflet. If you want to save the important information from this video, take a screenshot now. This video was co-produced by a group of pharmacists, doctors, nurses, and young people for Med.Info.
Thanks, Caroline. They're brilliant videos. They're really good. And Dawn has dropped a lovely kind comment into the chat for you. I'll let you read that in your own time, but it's very complimentary and probably exactly what we're all thinking. Josephine has a quick question there, just to know around the signposting side of it. Is that something we as pharmacists you're encouraging to do, or is something that the clinicians at the Mental Health Resource Centre would engage with? Who does this lie with?
So I think, like, I guess now for us, it's very much a case of telling people that this exists. You know, now we obviously, there's no marketing module in pharmacy technically, but it's so interesting to know that you obviously can do loads of work and develop a resource, but it's absolutely no use at all if people don't know about it. So this is kind of where we're at the moment. And I guess for pharmacists, especially, community pharmacists are people who are dispensing prescriptions for young people and for mental health medicines, having an awareness that this exists it is, I guess, what we're hoping for from this. So whether they want to, I guess, I've actually found myself, having been through the whole process, and especially the language, what's acceptable language to the clinician and what's acceptable to the young person. And now that I know what that is, when I meet the young people in work, I use the same language that's in the videos. I guess I obviously voiced the videos, so I'm almost reading in the script in my head when I'm talking to young people about the medicines. So I think there's kind of two benefits to this. Is one is if you are dispensing a medicine to a young person or to a parent who's worried about the medicine and their young person starting on a medicine, that you're able to signpost them to the website where they can obviously watch the videos, but also where they know where more information is available. The patient manufacturer's leaflet, the choice of medication website, and the NHS website. But also, if a pharmacist was to watch it themselves, and then they're able to understand, okay, this is the language that I can use when I'm talking to somebody about their medicine. And so I think there's kind of two parts to it, and that that's again something that we learned along this kind of journey. But that's, I guess, where we're at.
Excellent. That sounds it's definitely a learning tool for us as well in ourselves, not just a tool to direct people to. Can I ask you, Corinne, as well, listening to and seeing the list of people who contributed to it, how did you manage to incorporate all that feedback and all that commentary and kind of distill it down into what was essential?
Yeah, so it was really, like, it was stressful, but also fun in a way where, and I did it with Dolores. I think Dolores is on, Dolores Keating, who's the head of the pharmacy department. And so we would kind of, I would always, and it's so funny when I look at the WhatsApp, my WhatsApp media to Dolores is literally videos. And where we would kind of, we would discuss the feedback ourselves, and then we would kind of come up with a way of, I guess, meeting people where they were all happy. I mean, with the vomiting emoji, it was quite obvious that was to be removed, because everyone was like, no, take it out. There was some things, some people wondered about including side effects at all, but then, I guess the consensus was that we need to include side effects. I felt for this set of videos, there wasn't any really tricky points. But it was, but you do very much want to, like I said, you want everybody who is involved to be happy with it enough that they'll use it. So that was, it was, and like that, we're kind of at that point now with the videos for the children, where we have two complete opposite ends of a pole. Some people who want to include side effects, and then some people who say young children are too impressionable. An 8 and 9 year old, if you tell them about a side effect, they'll say they have it. So, so we're, so that, I mean, this is obviously a different group of people, but it is, that'll be interesting. But I feel like I was almost happy, even though it's really tricky, because I feel like if we get an answer to that, then everybody in between will be happy with the results, if you know what I mean. So it was kind of nice to have a complete opposite opinion.
Thank you. And if you had an ask of us, Caroline, how would you like us as pharmacists disseminate it, or how would you like us to use it from where you're sitting? What's your ideal?
So I've sent so I did a poster, as I said, with the QR codes, and I've sent that, and so I think you'll receive that in the supplementary material after this evening. So if that's something that you had, you know, if you printed that off in your dispensary, and like that, if you did dispense a medicine, or you got a parent or a young person coming in and inquiring about a medicine, that you're able to, you know, get them to get their phone out, or you get your phone out and show them the video. And it is nice. I like watching the videos with the young people, because you know, it's nice that I guess there's that element of there's someone there beside them supporting them, and they're not alone. So it is kind of a nice experience to watch it with. So if it is something you do in the consultation room, you just sit down with an iPad or a phone and just watch the videos together. And then like that, they might say, oh, well, what about this? Or they might have other questions. And then you can answer them, or you can signpost them to more information resources, I guess.
Super, thanks a million. So I guess Grace might kindly send that out to all of us after tonight's session, and we'll have that information inside in our dispensary so we can access it. If there's no other questions, Caroline, thank you so much for obviously pouring your life into generating this over the last while. Really worthwhile project, and I think for us all a huge resource that we can encourage, for me, students to utilize and access as a part of their learning tool, for people in practice to share with their patients and other clinicians, and interprofessional sharing of that resource would be wonderful. I might get Grace just to pop me up to, oh, thank you. That's lovely, Grace. Thanks a million. If you could take a few moments, we'd really appreciate if you could give us a quick little bit of feedback on our session tonight, so that we can use it to identify the kind of things pharmacists are looking for from the IIOP for resources. I will bring your attention to our next in conversation with, reflective practice, apologies. Do write up a CPD cycle. Take some time this evening at the end of the session to take some time into your e-portfolio. Take away, what are your learnings from this, and what could you do differently in your practice now that you've acquired this new nugget of information. And we are back again next Wednesday at 8 p.m. again, same time, same place. But this time we will be joined by Joanna Corer from the PSI, Pat O'Mahony, who is coming from the original steering group, Katrina and Sarah from the IIP, who will be talking about the expansion and expanding role of the pharmacist, and what's going to be coming down the tracks for us in 2024. So that will be a really interesting session, and it's falling out of the workforce survey that the PSI have been working on over the last few months and published there recently. And it's for us to find out, I suppose, next steps on that, and where they're going to bring us and what that journey is going to look like. So definitely an interesting session for all of us. So thank you all, especially thanks to Caroline for all her hard work and her commitment to this project, and a wonderful resource for us all to gain. Thank you all for dialing in tonight. It was lovely to see you all, and hopefully we'll see you back again next week. So thank you all, and good night.
Thanks a million.